Hello, everyone. Hi there, I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. We are here on Monday, October 25th, to give you our weekly update on the impact of the COVID-19 pandemic on Mobile County. I want to go back to something that we used to do almost every time and just give the sort of global perspective of where things are with the COVID-19 pandemic. So worldwide, there have been about 245 million cases of COVID-19 and just under 5 million deaths worldwide. And those numbers are quite shocking, but I think still what continues to baffle me is that, the United States of America still has the highest number of COVID cases and deaths than any other country in the world, and yet we have the best and greatest access to vaccination and other therapies that are coming out or that are out to treat COVID-19. So in the U.S., there have been about 46 million cases of COVID-19 with greater than 756,000 deaths. And that is we have about 19% of the world's cases of COVID-19 here in the United States and about 15% of the world's deaths. The country in second place has a population that's 4 times greater than the United States and have fewer cases of COVID-19. That's India, around 34 million, and they have fewer deaths than the United States. That is fewer than 455 or around 455,000 deaths. So again, I don't often talk much about the worldwide numbers anymore, but I just wanted to give you that perspective today. We've not done that in a while, that we are responsible for almost 20% of the world's COVID cases, and the most powerful country in the world, and have lots of prevention measures at our fingertips, and we could be doing so much more than we are in trying to prevent COVID. But the Delta wave is almost over. I am so thankful and hopeful and grateful to all of you and for all of us that have been working together to try to get through this very historic wave of Delta variant of COVID-19, where we saw record numbers of cases and deaths and hospitalizations in August and September. So the good news is that cases are still low, hospitalizations are low, and deaths are going down. Really good news. The percent positive is still a little bit less than 5% statewide. In Mobile County, it's just at 5%. So all of those are really good things. So it's been a real opportunity for us here at the health department to exhale a little bit and really be thankful for the numbers continuing to go down. And hopefully within another week or two, we will hit our lowest point of COVID cases and hospitalizations and deaths. That would be really, really awesome. So despite everything going in the right direction for many, many weeks now, we are still classified by the CDC measure as being in a substantial level of community COVID transmission. So we still have greater than 50 cases per 100,000 being reported on a 7-day rolling average, which keeps us in that substantial risk category, even though with the other measure that's included, the percent positivity, it's less than 5%, which is in the low risk. So those two things combined keep us in the substantial community transmission. We're still in the orange, but hopefully we will go to yellow sometime later this week, and then who knows, maybe next week we'll be in the blues for very low risk. And CDC says, if you're fully vaccinated and community transmission is low, that people who are fully vaccinated should feel very confident being outside without their mask, maybe attending smaller gatherings indoors, particularly if it's people that maybe relaxing some of those masking recommendations. So we're not quite there yet, but I think we'll be there very soon, and we're very thankful to everyone out there who's been very patient and continuing to get vaccinated, get booster doses, continuing to wear your face covering and distance when you're around people that you don't know. So that is really good news on the pandemic outbreak front as it relates to Mobile County. So yesterday we reported on today's report, we're showing 72,786 cases of COVID-19. Just 13 cases were reported yesterday. We always see the number go down after the weekend, but that is a really low number, one that I have not seen in a very long time, so very happy about that. We had 0 reports of COVID deaths yesterday, and yesterday just 6 new COVID diagnoses and hospitalized patients were reported. The last 3 days, there were less than 40 people in Mobile hospitals with COVID-19. So that is just really, really good news for our community and also for our hospitals who've been, as you know, really doing a fantastic job, but just overwhelmed in these unprecedented times that we have been experiencing since March of 2020. All right, there are a couple other things that I wanted to report on with regards to data. Just to mention that, because booster doses have been approved and a third dose has been approved for people who are immunocompromised, we are seeing a small uptick in the number of people seeking vaccination, but it's mostly those people who are seeking booster doses. So we still are giving very few primary vaccination to people. So these are people who have never been vaccinated that start the series. So I think the last 2 weeks we've seen each week less than 1,000 people get vaccinated in Mobile County. So this trend, we need to go in the other direction. So please, if you have not gotten vaccinated, please reconsider doing so. And again, the groups that we really are focusing on are those younger age groups that have very, very low vaccination rates, because our senior community members are doing a good job of getting vaccinated, but we need those younger age groups, particularly people who are 12 to 17, to get vaccinated, to keep people in schools and to lower COVID transmission around our county. We have started monitoring flu season this year. Already in Mobile, influenza B has been isolated from a Mobile County resident. So still, we're still seeing very low percentage of ED visits and other doctor's office visits being for influenza-like illness, but it is here, has been, detected in at least a couple of specimens in Mobile County. And then I think we were going to talk a little bit about the information that came out last Friday about the authorization of booster doses. I believe it's on this side of me in the screen, so hopefully that's it. It is a little bit confusing, I'm not going to lie. Sometimes when you're trying to take it all in, it can be a little confusing. So that's why we're very happy that the Alabama Department of Public Health put this guide together very quickly on Friday that sort of helps people and helps us think through booster doses when they're recommended and the timing and the volume of that dose. So again, for Pfizer, the booster dose is recommended 6 months after completion of primary series for people 65 and over, 18 and over who are at high risk of severe COVID, 18 and over who live in a congregate setting or work in a high-risk setting. So you can get either Pfizer or the Moderna booster dose, or J&J. I think most people are sort of turning to Pfizer and Moderna as they have shown higher effectiveness against preventing hospitalizations and deaths. If you had a Moderna primary series, then 6 months after the completion of your primary series, it's recommended that you get a booster. And again, the same group, 65 and over, 18 at risk of 18 and over with high risk of severe disease, or 18 and over who live or work in high-risk settings. And again, Pfizer, half a dose of Moderna, or Johnson & Johnson. And then for people who got the one dose, one and done, we called it, of Johnson & Johnson, you should get a booster just 2 months after your completion of your single dose. So anybody who received Johnson & Johnson, so that was approved for 18 and over, anyone who got a shot of J&J should consider or should get a booster dose to help boost their immunity to COVID-19. All right, a couple of things about vaccine clinics. So we are still offering walk-in testing and walk-in vaccination with all 3 vaccine products Monday through Saturday at our New Bern location on 248 Cox Street. This week it will go Monday through Saturday, our normal times, so you can check those out on MCHDcares.com. Then next week we are going to have a slight interruption in our services at New Bern, and that Tuesday we will be closed at New Bern for staff training, but of course, as always, vaccines and testing will be available by appointment by calling 690-8889. So more to come on that when we get that finalized. We'll release that on social media and make sure to update that on our website. Other opportunities for vaccine from the health department, also these are all on mchdcares.com, so you don't have to write them down. So October 27th, we'll be back at the Dauphin Island Town Hall from 9 to 12. On October 28th at New Hope Outreach Ministry on Spring Hill Avenue in Mobile. That's October 28th from 10 to 12. On October 28th, 9 to 1, we will be at a health and wellness screening that's sponsored by the Saraland Lions Club. That will be at 716 May Street in Saraland. Then we will be at LaFleur High School on October 29th. 700 Donald Street. And then on Saturday, October 30th, there will be a clinic at Friendship Missionary Baptist Church on 545 Cody Road North. Again, Saturday, October 30th, 9 to 1. The only other news that I have to share is a rabies clinic. So I'm working with our veterinarian, Dr. Ann Branch. We have drive-through rabies vaccination available at $12 per pet, cash only, drive-through rabies vaccination. I think I said that. But this Saturday it will be from 1:30 to 3:30 at Cuddles and Kisses on 11120 Meadow Lark Road in Grand Bay. So again, bring your companion animals, dogs, rabbits, dogs, cats, and ferrets for rabies vaccination to keep those animals safe and to keep those people around them safe as well. So any questions?
No questions, but the last one.
That's right. So Mark is saying that there aren't any questions today. So today's episode of Facebook Live will be our last for a while, because our last scheduled Facebook Live. The numbers are going down. Everybody's doing a great job. We're finding time to squeak other work into our lives, non-COVID work, take a day off every now and then. And so we will disband with our normal schedule of Facebook Live. But remember, we'll always come to you anytime there's something new or important, or if anything changes, we will announce on social media when we will come back online to give you updates if that's needed. I think last summer, when we announced that things looked so good that we would stop doing weekly Facebook Lives, I think Mark and I had 2 or 3 weeks without Facebook, and then had to start back with nearly daily updates. So we can be nimble and flexible and get right back in front of Facebook and online with you if we need to. So everyone, just please enjoy your fall. The weather's been really nice lately. But, be smart about your social activities, about the gatherings that you attend, about your holiday ventures, and, the things to do to keep yourself and your family safe. We all do. And just, be safe out there, be smart, and we'll talk to you next time.